With age and activity come the aches and pains of worn-out parts. In the past, doctors turned to total hip replacement, but there have been advances in the field, including hip resurfacing as an alternative. This afternoon, Dr. Jason Weinstein of Boca Raton Regional Hospital joins us to take us deeper into the procedure. Thanks so much for joining us.
Thank you.
First, what is hip resurfacing?
So hip resurfacing is essentially a total hip replacement, but essentially in traditional hip replacement, if this is the femur, the ball and part of the neck are removed in traditional hip replacement. And in replacement, the part that's been removed has been replaced now with metal. Hip resurfacing, essentially, the head of the femur, or the thigh bone, is preserved, as well as the neck. It's essentially reshaped and then capped, thus the name hip resurfacing. The cap, or the ball of the femur, is essentially just resurfaced with metal. On the socket side of the hip, okay, the socket being part of the pelvis, that essentially is similar to traditional total hip replacement. So the real difference lies in what happens on the thigh bone side.
Okay, and how do you determine if a patient is a candidate?
Right, so essentially the decision to have a total hip resurfacing is only a decision that one can make after a long discussion with their doctor. There are obviously pros and cons to hip resurfacing. Not everybody's a candidate, and it's really been marketed and found to be best in younger, active patients, mostly less than about 60 years old.
Okay, and we had a viewer write in and say, I suffer from bone cysts. Am I eligible for hip resurfacing?
It really depends what type of bone cysts those are. If you have large bone cysts that take up several centimeters of the head of the femur in the thigh bone, it may destabilize the interface here between the resurfacing component and the bone, and that might render the patient a candidate who is probably not suitable for this procedure.
Can you resurface both hips at the same time in the same procedure?
You absolutely can. It's a procedure that only would be done in a very healthy patient. Obviously, the risks would be increased, such as blood loss and possible cardiovascular risks. But it's being done, but it's a decision that can only be made after the risks and benefits of that versus doing one side are balanced against each other.
Okay, and really quickly, another viewer question. Do my chances of dislocating my hip increase after hip resurfacing?
No. The chance of dislocating should remain the same if it's done appropriately.
All right. Thank you so much for joining us. And our Boca Raton Regional Hospital sponsors our expert and underwrites Ask the Doctor.
Ask the Doctor is sponsored by Boca Raton Regional Hospital, which provides the physician for this segment.